Namaste and hello everyone. Thank you for your warm welcome, and I feel very honored to be invited to speak in front of you in a country uh, in front of many very good homeopaths from India. So this is really a very great honor for me. And I would like now to share my screen.
Please proceed.
It is visible?
Yes.
Okay.
Yes, ma'am, it's visible.
Okay, thank you. So my topic for today is the homeopathic approach in the thyroid-related diseases. Just a minute. I don't know why I cannot move the slide. What is wrong? Let's try again.
There is a button at the left lower corner. You have to click that button.
I try again. Okay. Okay, now. So here you have a few information about myself, but you already told this about myself. Maybe just I would like to add that I studied also astrology, psychosomatic medicine, New German medicine, gemotherapy, Schüssler salts, and about Bach flower therapy, among all the other. And this is important. You will see in the next, because so I would like to express my gratitude to all my teachers from Romania, from Greece, and from India. And I would like to start with this idea, the classification of thyroid diseases. As we all know, we can speak about the enlargement of the gland. When we speak about goiters or tumors, there is hyperthyroidism, like the Graves' disease, toxic multinodular goiter, or toxic adenoma, or hypothyroidism, like the Hashimoto thyroiditis, the subacute thyroiditis, the riedel thyroiditis, and congenital cretinism. But I think that the information regarding these diseases, you can find everywhere on the internet, in the books. So I would not like to speak a lot about this, but I would like a little bit to speak about how we can see the thyroid diseases in a holistic way. And I would like to start with this idea of the Rumi, that the cure for pain is in the pain. And I like very much this idea, which was formulated by Dr. Edward Bach about what is disease. He had written that disease is the result in the physical body of the resistance of the personality to the guidance of the soul. It is when we turn a deaf ear to the still small voice and forget the divinity within us, when we try to force our wishes upon others or allow their suggestions, thoughts, and comments to influence us. And this is very important in order to see a disease much deeper, not just in a superficial level. And I think that all of you would know that the thyroid diseases, it is related to the imbalances of the level of the throat chakra, because as I said, I am interested in astrology, and in fact, I have in plan to teach a medical astrology course in Homeopathy World Community. So this information is from my course, and this is very important when we have to deal with patients who have thyroid diseases, to keep in mind somewhere that this is related to the imbalance at the level of the throat chakra, or we should have. Why? Because when our throat chakra is balanced, then we have a good self-expression and we can express our creativity. But when our throat chakra is imbalanced, it means that the person has somewhere a blockage at the level, this level. So there is a blockage in the ability to express herself. And what about the homeopathic approach? As we all know, homeopathy is based on some basic principles formulated by Samuel Hahnemann. And maybe the two of the most important principles are the individualization, which means that we treat the person, not the disease, and the holism, which means that we take in consideration the totality of the symptoms on mental, emotional, and physical level, but also the causality and the life circumstances. So taking in consideration all these issues, I would like to present to you my first case, which was a 56-year-old woman who presented Hashimoto's thyroiditis and hypothyroidism. The first consultation took place on 10 December 2019. As chief complaints, she said that she presented vertigo since 2 years in the morning or during the night if she would like to get out from bed, and she was treated with Betacel. She also presented headache daily like a band, especially after dinner when she is more tired. She presented a stiffness of the back at the level of the lumbar region, pain in abdomen with a bearing down sensation, and she also had menopausal symptoms like hot flushes and sweating in the morning and evening. She had numbness of fingers in the morning on waking, and she presented also an onychomycosis of the two and her hair falling intensely. About her history, I find out that from her personal history that she had a tendency to taking cold frequently, and she used to have pneumonia 2-3 times per year. And from her family history, I find out that her mother and sister suffered with hypothyroidism, and also she had a sister who died of breast cancer. Now, in homeopathy is also very important the observation, and I could observe that she was a very shy person who avoided eye contact. She was very sad, crying continue when she talks about her problems, and she said that she does not like to take medicines. Now, according to this holistic understanding, from the theory, we know that the thyroid diseases are related to this blockage at the level of the fifth chakra, as I said, which means it is related to how I communicate my truth, how I express myself. But our job as homeopaths or as therapeutes, it is to explore how this blockage is happening in the patient's life. And this we can find out during our case taking. And why is this important? Because according to this holistic understanding, a disease is nothing else but a lesson. And through the disease, the person will have to understand that which attitude, way of thinking, emotions need to be changed. So if we are taking our case properly, during the case taking, the person will realize, will have some self-awareness. And this is very important in order to recovery. And we, as homeopath, we can encourage the patient in making the changes. Exactly as my colleague yesterday, Dr. Hetal Mehta, presented about psychotherapy, it is in the same idea that finally our job is not only to give the person the remedy. Of course, this is also very important, but during the case taking, we can help even more the patient in order to get this self-awareness. And so in order to this, I asked her that what was the greatest stress in her life when all this illness started. And I find out that her sister died 2 years ago, and she regrets not being able to reach her before her death. And actually, her mother-in-law has Alzheimer's dementia, being immobilized on the bed, and she takes care of her. So she feels all the time exhausted, but she used to swallow her frustration. And she had also a husband who was very sick. Later on, he was diagnosed with schizophrenia, but actually he suffered with this problem since more than 10 years. And so in the house was a very unhealthy atmosphere. When I find out that I wanted to find out how she copes with the stress of her life, she said that she tries to please both of them. I mean, the mother-in-law, which she took care, and also the husband. She gave up many things for the sake of her husband. Her husband is very jealous. She couldn't talk to her family because of him. She kept being dominated by him. She made far too many compromises for her husband, and she has been mentally abused by her husband for many, many years. For example, she could not breastfeed her last two children because the lactation stopped due to stress. So when I asked about her fears and her nature, she said that she has a constant fear of being injured or aggressed by husband, because he can be very violent, unexpectedly, threatened her repeatedly that will kill her. And I asked her that how she managed this situation. She said that prayer helps her. She prayed a lot and fasted a lot. About her nature, she is sensitive to noise, introverted, does not like company, likes to be alone. She likes to walk, to stay in nature. She likes also to embroider and to read. About her physical genitals, she is chilly, likes warm weather. The sleep, she used to wake up around 3 or 4 a.m. every night. The sleep position was on the right side. She had craving for sweets and salty foods. She was thirstless. She presented repeated urinary tract infection before, and now she has urinary incontinence. About the stool, she has this constipation, difficult to evacuate, and she has the feeling that she didn't evacuate everything. And to show her lab test, so when she came to me in 2019, she had this value, the 6.53. In August, the next year, the value decreased. She had 5.06, and at the end of at the last consultation, which happened in 30 October last year, the value became normal. It was 3.95. So how to analyze this case? When I analyzed the case, I saw that there were a few peculiarities. For example, at the mental level, it was very obvious that she tried to please husband and mother-in-law. She gave up many things for the sake of her husband. She kept being dominated by him. She made far too many compromises for her husband, and she has been mentally abused by her husband. At the physical level, she had the hot flushes, the pain in abdomen with the bearing down sensation, the urinary incontinence, the constipation, and the weakness. So when I tried to repertorize the case, the following rubrics were very important. The ailments from mind, ailments from domination for a long time. The next rubric is undertaking things opposed to her intention, and contradictory actions are contradictory to intentions. So when I repertorized her mind symptoms, taking in consideration all these, like ailments from suppressed anger, ailments from domination for a long time, the company aversion ameliorated when alone, the contradictory actions to intention, the fear that something horrible will happen, because she had continued this fear that her husband can be aggressive with her, fear of injury, the praying, the desire for read, the sensitivity to noise, and weeping when telling of her sickness. So the remedy was sepia. And also from the sectorial repertorization of her physical generals, taking in consideration her vertigo, which was her chief complaint when she came, her hair falling, the headache, the thirstlessness, the bearing down, pain in abdomen, her constipation, the involuntary urination, the stiffness, the swelling of the knee, the tendency to take in cold easily, the hot flushes, and of course the hypothyroidism. Again, the remedy is sepia. So I should make the differential diagnosis with the other remedies which were the carcinosin, ignatia, pulsatilla, and staphysagria. But I think that the most easy way to make here the differential diagnosis is based on system approach, because in this case, it was very obvious this the main theme was this me versus others, because she felt as a victim of husband and of mother-in-law. So this point to an animal remedy. But her coping mechanism was the withdrawal, the desire to please others, the company aversion, and walking ameliorate. So all these together points to the remedy sepia, which is an animal remedy from the mollusk family and has this leprosy miasm. Now, the confirmation from the Materia Medica, from Dr. Shankaran's Soul of Remedies, we can read about sepia that the main feeling of the sepia woman is that she is forced to undertake things opposed to her intention to do what she doesn't want to do. Is a chronic situation in which she has been dominated and not allowed to have her way. From the same book, we can read that has this dependence, maybe emotional or financial. So often she is forced to do what she does not want to do. And this is the uncompensated fate side of the remedy. From the same book, we can confirm all these rubrics as I presented before. Further, we can confirm from Murphy's Nature Materia Medica the crying when telling her symptoms, weeping worse from consolation. Also from Murphy's Nature Materia Medica, we have this aversion to those loved best, to family, aversion to sympathy and company, desires to solitude, and the great falling of the hair after chronic headaches or at the climacteric. So, from the same Murphy's Nature Materia Medica, we have also this weakness in lumbar region, the bladder, the chronic cystitis, the prolapsed bladder. So all her symptoms practically can be confirmed from the Materia Medica. From acute reverse repertory, we have the rubric related to her constipation, this ineffectual urging and straining. And from the same acute reverse repertory, we have also the confirmation for her involuntary urination. Okay, so now in conclusion, I can say that the blockage at the level of the throat chakra has manifested in her case because she made far too many compromises for her husband. So she tries to please both her husband and her mother-in-law. So in this way, her fifth chakra was blocked. She kept being dominated by him. She gave up many things for the sake of her husband. So the lesson for her was to change her attitude toward husband and to become more assertive. And which is very good that during all the process, she became aware of this, and she recognized finally that her need is to find time for herself, and she asked for help from her children to treat the husband, because this was the main issue, that the husband being so jealous, he was pathologically jealous, and he needed psychiatric treatment, which before he refused. But now, thanks to the remedy of sepia and thanks to the insights and recognition during this process of homeopathic consultation, she became aware about which was her problem, that she was not enough assertive, and in this way she recognized that she needed to find time for herself, and finally she find the strength in herself to ask for help from her children, and finally they together took the husband to the psychiatrist. So in this way, I find very important to understand the disease and the pathology in a deeper level, and not just to give a remedy, but to help the patient to realize what is her real problem, and of course only also encourage her to take those steps in her life. So as you can see, finally, I can say that it is very important that the remedy, the pattern has to be the same pattern in the remedy, which correspond to the blockage of the chakra. As Carl Jung formulated, a man is ill, but the illness is nature's attempt to heal him. Because deeper than the pathology of the thyroid level was that problem of her to be assertive. The next case was a diffuse goiter, thyrotoxicosis, a basket of disease with hyperthyroidism in a 40-year-old woman. The first consultation took place at 11 December 2020. The complaints why this woman came to me, she was a young mother of a 1 year and 5 months old baby girl. So these were the chief complaints: that she lost 15 kilograms after pregnancy, her appetite increased, and she presented palpitation. She was a kind of very secretive person. And this is also something which we can understand, because these patients having this thyroid pathology, they have blockage at the level of fifth chakra, which is related to communication. The laboratory tests in this case were very bad. At the 2nd December, she had this lab test. So the anti-TPO was more than 3 times higher than normal. The FT4 was again like 3 times higher than normal. And the TSH was lower than normal. So because of this very bad laboratory test, she was very desperate. But as I said before, she was a little bit secretive. So again, I had to ask her that what was the stress in her life before this illness started. And she said that she was stressed that she could not find a partner, and she was afraid that she would not have a child, because she was 37 years old and she was not married, and she was desperate to have a child, but she could not find a partner. Related to her job, she said that she was in 2 boats, and here I quote exactly her words. Because she was working on something she didn't like, and she would have liked to do something else from which she could not earn a living. So from here, she had this inner conflict in herself, that doing something which she didn't like, and she would like to do something from which she could not earn a living. The reaction on the stress on the physical level was expressed as cramping pain in epigastrium and tightness in the chest. About her nature, he was cheerful, sociable, curious, extroverted. She likes nature. She had several relationships. She said, I clung easily to anyone. I was desperate. But she did not felt loved in these relationships. She lacked attention and care and the time spent together. She was more religious by nature, goes to church frequently. She needs control. She likes things the way she wants. She doesn't like any tightness, not even on a physical level to tighten it. She doesn't wear a bra. This was a very peculiar thing, which I find, that she wears a very transparent t-shirt without the bra, which is somehow unusual in our culture. When a person goes to a doctor, usually a woman used to wear a bra, but she hadn't. About her job, she worked on a project related to the Danube Delta. Here she felt betrayed that her friend did not tell her about this project. She attaches more easily to objects and people. Her passion is to go to the countryside where people are simple, like there in the Danube Delta, where she began her PhD. She said, I quote, to go far to an exotic place, and I arrived in a village, a snake hole. About her fears, she had fear of cancer, fear of COVID, fear of diseases in general, does not like to take medicines. She also had fear of mice, but very interested was that she held a snake in her hand, having no fear of snake. She is sensitive on being betrayed. This happened to her earlier, and when she felt offended, she used to scream and slam. About her childhood, she was always worried if her father loved her or not. She said, my mother didn't have time for me. She became disappointed also by father because he gambled. He had a double life. Her mother didn't know where he was. She had an older sister with whom she did not have a good relationship because she, the sister, showed a desire for control over her, which bothered her. About her physical genitals, she was warm-blooded. During the sleep, she had this palpitation on lying down. Her sleep position was on sides or an abdomen. She used to masturbate before marriage. She has a constant pain in her throat since a few years, resistant to any allopathic treatment. She had desire for aubergine, salty food, ham, and cheese. The thirst was present, she was constipated, and the menses was regular before giving birth. About her laboratory test, in 12 January, so 1 month after she started the treatment, you can see that the FT4 became normal when a month before it was very, very high, more than 3 times higher than normal. And the TSH, it was not normal, but the situation was better as before. So at the first follow-up at 12 January, she said that she feels much calmer mentally. Her fear of illness reduced. She reacts more calmly than before. Her mood is good. She sleeps well, and she began to dream. And on the last follow-up in April, in 7 April, you can see here that all the 3 values became normal. Now, how to analyze the case? We see about her teams that she said that she had this feeling of being in 2 boats. She had the inner conflict related to her job, this split will, which kind of job to choose, that she clings easily to anyone. She does not tolerate any tightness. She felt of being betrayed. She had no fear of snake, but she had fear of diseases, and she had a constant pain in her throat. So the main rubrics in this case was the heart complaints accompanied by thyroid complaints, and the other was the hyperthyroidism. And when I repertorized again all her symptoms, the disappointment from love, because she was disappointed many times, having many partners before, the anxiety for her health, her nature being cheerful, communicative, curious, the fear of being betrayed, the fear of diseases, her religious, she was occupied with religiousness, her suspiciousness, and 2 wheels, the remedy which covers is lachesis. And also from the sectorial repertorization, taking in consideration her throat pain, the chronic constipation, the palpitation of the heart, the hyperthyroidism. So all these issues, the remedy again is lachesis. It was very interesting that this very peculiar thing which she had, that she was shameless exposing her breast, wearing no bra. It is a single remedy, which is Bungarus fasciatus. Maybe this would be her very deep remedy, but the other symptoms confirmed lachesis. So finally, I gave her lachesis, and well, this is a well-known polycrest, which all of us we know very well. Just a few words I would like to say about lachesis. We know about this jealousy, which is very powerful in lachesis. Another very important issue is this aversion to change, which is most extreme in lachesis. So they have this change of season, change of weather, and change of life. And also they feel worse on waking, because this is another kind of change when the night changed to day. So it was very interesting in her case how she resists somehow to change, having faced this difficulty in choosing one job or the other. It has also this affinity to blood and hormones, and has this destructive feature, and this is a syphilitic remedy. This information are from this little book from Peter Fraser, The Transformation Between the Realms, Snake, Drawing Power of from the Underworld. And I like very much this book. In this little book, I find this confirmation that their concern is with a world that is out of their control and which may destroy them. Their reaction is to impose order and control on everything around them, which also in this case, it came again and again, this issue about the control. I could not find this in rubrics, but in this little book, it is very well written. And but this feature I find in most of my cases which needed lachesis. This desire to impose order and control. The other characteristic that they are clairvoyant, the snakes are sensitive to other people's. These are some other issues which I am sure that all of you know very well. So the periodicity is another very important feature, that they do not like the changes. That is why they can present aggravation at pregnancy and or delivery. They are solitary animals. They have this powerful sexual instinct, as it happened in my patient. She used to masturbate before, and they are the masters of disguise, manipulative, charming. They can use their look. Here is the rubric foppish, and they have important affinities for the throat, as she presented continuous pain in throat. And another very interesting little peculiar thing is that almost always they are constipated. Okay, so the conclusion in this case was that in her situation, this blockage at the level of the throat chakra, so it manifested as her creativity was blocked as a woman, because she desired so much to have a child, but she could not find a partner. And she was also blocked professionally, because she had to do a job which she did not like. So that is why the cause was an inner conflict because of her job and this desire to have a child, which was suppressed for many years, having no partner. So the lesson for her was to manifest her creative ideas, to do the job which she likes, and to be a mother. And for this, for her recovery, it was very important to realize this. So in order to realize this, it was important to become congruent, assertive with herself. So to not accept a job which she didn't like, and to adapt after others, for example, after husband, which is the sacrifice to have a child. Because this was very difficult for her to adapt after others. This was the price to have a child. So I would like to end with this idea from Stephanie Gailing, that healing is the end of conflict with yourself. So this I find very, very important, not only to give the patient a remedy, but also to help the patient to become aware about which is the problem and which kind of changes she needs to make in order to recover. So thank you very much. Yes, I did this basic astrology course, and I will plan the medical astrology course in the homeopathy world community. And the idea is that all these knowledges can help us to understand our patients as a whole. Thank you.